Hello everyone, I am Dr. Bonali Das, consultant of 𝑾𝒐𝒓𝒍𝒅 department, that is medicine, Ayurvedic College and Hospital, Meghalaya, USTM. Today we are going to discuss about a disease which we can say a silent killer, that is diabetes mellitus. In Ayurveda, diabetes mellitus is known as madhumeha, and the cause of the madhumeha is genetic disposition, and the most common cause is sedentary lifestyle. Aisya sukham, sapna sukham. If we are not controlling our ahar and bihar, then it leads to this killer disease, that is diabetes mellitus. If we are not controlling our blood sugar level, then further it leads to diabetes neuropathy. Signs and symptoms of neuropathy like numbness, tingling sensation, sharp and burning pain, needling pain, sensitivity to touch, sore, and leads to blister. So, how we can control our blood sugar level? How we can prevent it from this killer disease, madhumeha? Our another consultant is also present here from 𝑑𝒓𝒂𝒃𝒆𝒓𝒔 department, Dr. 𝑘𝒐𝒓𝒍𝒅, and she will give you the tips and suggestion how to prevent it from this disease and how to control it, the blood sugar level and lifestyle modification. So I welcome Dr. 𝒓𝒂𝒃𝒆𝒓𝒔.
Thank you, Dr. Bernali. Hello everyone. This is Dr. 𝒓𝒂𝒃𝒆𝒓𝒔, consultant, Department of 𝑫𝒊𝒂𝒃𝒆𝒓𝒔, which deals with preventive cure, therapeutic diet, therapeutic yoga and lifestyle modification in Ayurveda. So today when we discuss the topic of diabetes with our viewers, I'd like to highlight the theme for 2024, that is breaking barriers and bridging the gap. So in the era of advanced medical technologies and super hi-fi healthcare facilities, what can be the barriers for a patient? The barrier can be, we have a lot of health facilities available, n number of doctors who can consult and prescribe you medications. But how long? How long are we going to gulp down those pills? And how long is it going to be sustainable? The question arises, and what else? Are the medicines only sufficient to control our diabetes or sugar levels? This is where bridging the gap occurs, and that is what the Ayurveda facilities available in our hospital is offering. Me as a consultant of 𝑫𝒊𝒂𝒃𝒆𝒓𝒔 or preventive cure, so I am dealing with patients of diabetes, consulting them or giving them counseling sessions regarding an Ayurveda diet. There we have therapeutic yoga sessions also, and we have relaxation sessions where we deal with the stress levels of the patients. In today's world, stress being one of the major factors for predisposing diabetes in individuals, it is very important to control stress in our daily lives. So we have the procedure of Yoga Nidra, which deals with quick relaxation techniques, deep relaxation techniques, and also muscle relaxation techniques, which relaxes your muscles to an extent where the individual feels the anxiety levels dropping down, his stress levels dropping down, and as a result, a very good functioning endocrine system. So I welcome you all to our hospital, that is Ayurveda Medical College and University Hospital of Ayurveda and Naturopathy, to gain the knowledge regarding the disease, avail the services that we are having, and join hands with us to curb the monster for today's society, that is diabetes. Thank you. And now, as we proceed, I'd also like to highlight that in today's era, diabetes is not only prevalent among the adults, it is also a burning issue for the juvenile generation. So to have an expert opinion on the juvenile generation, we have with us our Comorhitta consultant, that is the pediatrician, Dr. Sujata Banik. She will be highlighting you about the juvenile diabetes. Thank you.
Namaste everyone. Myself Dr. Sujata Banik,
consultant from the Department of 𝒂𝒓𝒂𝒂 here the campus of USTM Ayurveda Hospital. As already mentioned, diabetes is not only prevalent in adult nowadays. It is we have n number of cases, which is also, I think many of us know, as termed as juvenile diabetic mellitus. Juvenile diabetic mellitus is actually only coined for the children. It is not something that is been occurring as genetically. Most of the diabetes in children is occurring from autoimmune disorder, that in which it becomes a chronic condition where your pancreas or our very vital organ is not able to produce enough amount of insulin, and so that the child suffers from diabetes in a very early age of his life. Diabetes in children is mostly diagnosed from the age of 4 to 6, and in the second phase it is usually early diagnosed at the early puberty age, that is from 10 to 14 years of age. The symptoms of juvenile diabetes is very commonly as in adult, like excessive thirst, hunger, weight gain, then bedwetting and or more urination, tiredness, fatigue. These are the early signs of juvenile diabetes, and most commonly children, they feel tired, but the parents, teachers, they are unable to understand because they feel the child may be exhausted or fatigued because of the overburden classes, overburden workload, extracurriculum activities. But it is also a sign where your child can be suffering from this autoimmune disorder, which should be ruled out as early as possible. And in today's era, the very biggest culprit of this diabetic mellitus in children is the junk food that your children is been taking on a daily basis. These junk food lead to weight gain, and which will actually affect our endocrine system, and it will again lead to this autoimmune disorder. In Ayurveda, we usually have yoga practices for pediatric cases, which actually mostly targets to overcome with these autoimmune disorders. There are many medicines which are being actively used to treat the juvenile diabetes as early as possible, and also there are many other naturopathy therapies that are specifically used for pediatric cases, which can be used for the juvenile diabetic mellitic cases, so that it can be cut down as soon as the child is being diagnosed with this disease. So with this, I'd like to end this podcast, but I'd also like to say, on the occasion of this Diabetes Mellitus Day, that we as whole doctor fraternity and also as a healthcare fraternity, we really want people to know this in their it is a part and parcel. It has become a part and parcel of everybody's life, from starting from children, starting from neonates actually, to adults, to old age people, and people are not aware of this disease nowadays. So we want people or our common local people here residing near our campus to avail the facilities present here in our hospital and get benefit of Ayurveda to treat this disease. Thank you.